Okay, so the next shock we're going to talk about is obstructive shock. Obstructive shock. The key thing about obstructive shock is we're dealing with the heart. And basically what the idea is that obstructive shock is referring to the ability of the heart being able to pump blood, something outside of the heart itself, unlike cardiogenic shock. Cardiogenic shock is referring to the heart itself can't pump blood. This is the heart is working fine itself, but there's something stopping it from working, and that's why I kind of got that vice, right? Something's making it not work. So it's an outside source causing pump problems. Some of these you're looking at your pulmonary embolism, you're looking at a vessel obstruction, you're looking at a pericarditis, right? Like the pericarditis basically is the sac that surrounds the heart. It can get inflamed, it can get fluid in there. And what happens is because it gets inflamed and has all that fluid inside, the heart itself can't beat inside there. There's enough room for the heart to beat. A tension pneumothorax is when we build that tension up in the chest because of a collapsed lung and everything starts to shove and push against the heart. So it doesn't work. So a way to look at it is here is one of the things that we're talking about is the pericarditis, right? So if there's a sac that goes around the heart and it gets full of fluid and it creates restriction, right? It creates restriction for that heart to be able to pump back and forth. It can't constrict as well because it has limited ability because of that heart. The tension pneumothorax is the other one that we talked about. As you can see here, this is our lung section here. And what will happen is that if this lung gets collapsed, right, and we have that chest wall because it's sealed, right? This chest wall is totally sealed in. So as the air fills into this area here, it will push a shift, and it will shift and put pressure against the heart to make it harder for the heart to beat. It will actually push against some of these vessels too, like the inferior vena cava, which is down here, the superior vena cava and the aortic. So you get this shift, and that actually pushes against those great vessels and actually collapses them. So it limits the amount of blood actually that can flow into the heart, if that makes sense for everybody. I'm going to clean all that up again and just do a quick thing on the tension pneumo or the tension pneumo, right? So we got the tension pneumo still has that chest wall around it, which is sealed, right? You get the collapsed lung on this side. And what's going to happen is it's going to push over as the air builds up, and it's going to cringe on that. And basically what it's going to do is push against the heart. So it can't beat as well. It's going to push against some of these great vessels, maybe kink them off or partially occlude them or fully occlude them. If they're partially occluded, there's only so much blood that can get in. And then what we've done is we've decreased the preload, and which is going to decrease the output as well, the cardiac output. So we got to be aware. So that's the tension pneumo. That's that, and that's how the so we talked about the tension pneumo. We've talked about how the heart sac can get inflamed, or if you get fluid within this heart sac, that there's something physically stopping the heart from pumping blood. Or it could be the physical part of it could be actually just right here, right? We kinked off a great vessel. You could get a pulmonary embolism into one of the vessels that go into the lung and or back, and what that's going to do is it's going to limit the blood. So that's what obstruction is that obstructive shock basically is the heart is being obstructed by something else other than itself, right? Cardiogenic shock is the heart itself, something else that's obstructing the heart from being able to function properly, like the idea of decrease of blood because of a vessel being kinked off because of a tension pneumo, or the pressure against the heart itself in a tension pneumo not being able to beat properly is what obstructive shock is. All right, so we got one more, which is really actually three more to go, and we'll see you in the next one.